hold one eye closed. Just gonna see how your eyes are generally. So, and would you like to tell me what number this is? Okay, take a nice deep breath. Just checking you can hear this. So I'm going to test your hearing. I'm going to place some clips on your ear and part of it will go inside. And I'm going to play some sounds to you. Okay, how do they feel? This feels okay. Perfect. Okay, now I'm just going to begin with playing a couple of different sounds, and I'd just like you to tell me on which side you can hear. Okay, so starting now. Okay, and again. Perfect. The sound is going to be getting louder, starting from silence. I'd just like you to raise your hand when you can hear the sound. Okay. So starting now. Perfect. And then if you could let me know when the sound has stopped. Okay, starting from now. Okay. Okay, now I'd like you to tell me when you can hear the beeping sound. So starting from now. Perfect. And then let me know when the beep stops. Perfect. So just taking those out. Alright, and this one. Perfect. Ears feel okay? Good. Now, I'd just like to do some traditional hearing tests, alright? So, if I could just have you close your eyes. Okay. Can you hear that? Good. And is it on the left or the right that you can hear the sound? Perfect. Alright, just let me know when the sound stops. Good. And then just let me know how many times you hear the sound. Good. Good. I'm going to whisper a word in your ear, and I'd like you to just verbalize that. Repeat it back to me. Okay. Sleepy. Perfect. Okay, so hearing seems good, very normal. I'm getting a really sort of average range on your hearing, so nothing there to worry about. Okay, so what I'm going to do now is focus on your sight. So, just having a look first. Your eyes. Okay. I'm going to just look at the health of your eyes. I'm going to be using this. Okay. So I'm going to just come a little bit closer. I'm going to just... I need to come closer. Okay, there we go. Just going to hold one eye closed. Perfect. Perfect. I'm going to just look at the other eye now. I'm just going to hold this side closed. Okay. Good. Just going to place a couple of drops. One there. One there. Just blink. Perfect. Okay. So just coming in again. Looking right to the back of the eye. If you could just look down. And keep looking down. And then look up. Look up. Look to the left. And then to the right. And that's great. Okay. Any pain? No? Okay. I'm gonna check your vision. If I can get this open. There we go. So I have a number of different lenses. So what I'm gonna do is I'm gonna have you just look directly at me. Perfect. Have you ever done anything like this before? No. So what I'm going to do is have you look at me, and then I'm going to give you some instructions. So don't worry about it now. Just looking at me. Just going to cover one eye first. Okay. So, is that clearer with or without? With or without? Okay. Again, clearer with or without? Okay. And then is one or two clearer. That's one or two. Okay. Okay. Is it clearer without or with? So that's without or with. Okay. And then is it one or two clearer? That's one or two. Okay. I'm going to look at your other eye now. So one or two. Okay. And then without or with. That's without or with. Okay. And then again without or with the lens. Okay. And then without or with. Without or with. Okay. Finally is one or two better. Okay. So you don't need a change. You don't need to have any lenses. Alright, your vision is very good from what I can see with the lenses. I would just like you to just read through from the top all the way to the bottom, alright? Just gonna see how your eyes are generally. So good. 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 Keep going. Any of these bottom ones? That's okay. Alright. Good. You've done really well so far. Everything's coming across as very normal, or as normal can get. So, what I wanted to do now was check the optical nerve, and as part of that we look at your colour and how well you see and interpret colours. So I'm going to have you tell me which two colours you can see. So we have a colour on the outside and a colour in the middle. Perfect. Good. That's a red and a green. And then on this one, what two colours can you see? Good. Perfect. It's an orange and a green. Okay. I'm gonna have you take a look here, and we've got a green and a orangey red. Okay, a little bit harder. There's three colours going on here. So can you see the number in the middle? Can you tell me what that number is? It's a little bit tricky. Take your time. Okay, yep. 5, 7, 9, 8. Well done. Okay. And would you like to tell me what number this is? Perfect. And then what number this is? 94. Perfect. So just checking you can see what colour this is and this. Perfect. So I'm going to just check a few general responses in your eyes. So let's go. Here we go. So I'm just going to have you follow the light. That's perfect. Yeah, keep following the light. Okay, and now I'm just going to test your pupil response. Perfect. Okay, and make sure that's on the right setting. Alright, just looking at my nose and then looking at the light. Looking at my nose and then looking at the light. At my nose, at the light, at my nose, at the light, at my nose, at the light. Perfect. Okay. I can have you blink now. Blink twice. Okay, and then raising the brows. Okay, and closing the eyes. Perfect. Look left. look right, look up, and look down. Perfect. Okay. Alright, and then how many fingers am I holding up? And then on this side. And oops, here. And then here. Good. Perfect. Alright then. Okay. Now just before we finish the eye element, I'm going to just have you let me know when you can no longer see this, okay? So we're going to start on this side. Good. 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 Perfect. Alright then. Moving on to your nose, I'm going to just pop some gloves on. So I'm going to just take a look at your nose. Any issues in breathing, smelling, any strange smells? Okay. Alright, that all looks healthy. There's no obstructions, no swelling. Okay. So I have a range of different scents now. So I'm going to just have you have a sniff, and then you're going to tell me what you can smell. Alright. I better not show you what they are. Okay. Make sure they're labelled correctly. Okay. Just gonna have you take a nice deep breath in and out. Okay. Now let's try this one. May be a little bit tricky. It's not peppermint, it's close. Have another sniff. This is tea tree. Yeah. Yes, peppermint. Okay. Yeah, that's vanilla. Very classic sweet smell. Let's go with another one. So this should be very clear. Okay, take a nice deep breath. No, this one is actually cinnamon. Yeah, it makes sense now. Okay, and I'm going to have you close your eyes. And then I'd just like you to tell me which one is sweet. So, 1 or 2. Which one is sweeter? Perfect. And then, which one is the stronger smell? 1 or 2? Okay, yeah, 2. That was very clear. Okay. Wonderful. Okay, I'm just going to hold one of your nostrils. Take a nice deep breath in. Perfect. And then the other side, nice deep breath in. Perfect. Okay, any difference in there? No. Okay. Alright then, let's take these off, get fresh ones. So now I've got these tablets, but they're only filled with either sugar or salt. I'm going to place one of them on your tongue. It's going to dissolve, and you're going to tell me if it's sweet or salty. Okay. Okay, just let that dissolve. You can just kind of mush it around to help it melt. Your salt, okay. Good. Salt again. And sugar. Good. You can take a couple of these if you want, if you need a sugar hit on the way home. Alright, and now your touch. Okay. So, I'm going to just test how well your body is conducting vibrations and sending messages to your brain. Okay. Just checking you can hear this. Good. Still hear it. Perfect. Okay. Can you feel the vibrations more here or here? Good, okay. Again, 1 or 2. Perfect. 1 or 2. Perfect. 1 or 2. Okay. Just going behind the ear. 1 or 2 in front of the ear. Behind 1, in front 2. Good. On the collarbone 1 or the shoulder 2. Perfect. Can you feel this? Okay, close your eyes and just tell me which body part I'm touching. Perfect. Your arms, good. Stomach, good. Lower stomach, good. Head, wonderful. Knees, knee, perfect. Feet, wonderful. And your throat, good. Sternum, good. And then down the spine. Perfect. So everything is really normal. There's no concerns to me. I don't believe you have heightened sensitivity. I think your nervous system is working really well. Alright, if you do have any issues, do come back and I will be happy to redo the tests for you. Okay. Any questions? Yes, I can email this all to you. Okay. Take care.